Greetings, my fellow Coloradans. We'll be beginning in about 1 minute. All right, we will be beginning in just 30 seconds here. Hello, everyone, and thank you for joining us today. I'm here with Dr. Rachel Herlihy, our state epidemiologist, who's going to give an update about the latest information about the danger of COVID-19 in Colorado at an all-time high. We want to take this time to emphasize the importance of everybody taking the steps that you know the steps. Don't socialize with others. Don't go in groups. Just hang out with your own households. Wear a mask in public. The steps that you can take and need to take for us to win here in Colorado, save lives and get our economy going, slow the spread of the virus as we've done in July, as we've done in August, and remind Coloradans that with the increase in cases, it's really important to do even better. First, I know that a lot of folks are focused on watching election returns. I am proud that here in Colorado, we saw the largest turnout in the history of our state. We further cemented our status as a national model for holding safe, secure, reliable elections. I want to thank Secretary of State Jenna Griswold and her team, all of our county clerks, volunteer election judges, everyone that worked tirelessly to ensure that the voice of the people was heard in our state. And Coloradans spoke clearly, casting their ballot for change at the federal level with Senator-elect John Hickenlooper and Joe Biden. And Colorado voters also voted to ensure that Colorado can continue to be one of the very best places to live. I am so proud that Colorado voters overwhelmingly supported a measure to provide free preschool to every 4-year-old in the state. Colorado voters overwhelmingly repealed the Gallagher Amendment to prevent tax increases on small businesses and support our firefighters and local communities. And Colorado voters voted for tax relief for every Coloradan, reducing our income tax rate and paving the way for fiscal and tax reform. And while a lot of us are ready for the election to be over nationally, and there's uncertainty about the outcome of the presidential race, we want to be patient and make sure that every legitimate vote is counted. It's clear that our state and our country are somewhat divided. And for many people, this election was a little bit too personal. Maybe you lost a loved one due to COVID-19, or you saw your business suffer because of the pandemic, or you suffered job loss yourself. But you know what? Whether you're a Democrat or Republican or unaffiliated or a Green or a Libertarian or a Unity Party, whatever your affiliation, we all need to find the way to work together and move forward for a stronger Colorado and a stronger America. When folks were evacuated from the fires, the first responders didn't ask what party they belonged to or who they were going to vote for before helping them find temporary housing. Regardless of the outcome of this election, we need to remember that above all else, we're Americans, and we come together when times are tough. And now more than ever, we need to come together to come out stronger and to save lives during this deadly pandemic as we enter the final few months before we expect a vaccine. We now have 121,000 cases in Colorado. In the last day alone, 3,369 new coronavirus cases, an all-time daily high. We have 2,158 Coloradans who have passed away from this deadly virus, and each of those is a tragedy. And I want to express my condolences to the friends and family of those who've suffered loss in this crisis. Hospitalizations are now at 894, the highest they've ever been from coronavirus in Colorado. More hospitalized Coloradans now than there was in March and April. I really hope and trust that that's a wake-up call for Coloradans. You're Our attention might have been distracted by the election or dealing with the horrific fires. Now it's time to refocus on what we know we need to do to reduce this pandemic toll here in Colorado and to get our economy going. Since the beginning, thus far, frankly, I've been proud of Coloradans and how we've responded. It hasn't been easy. You know, I correspond via email to an 80-something friend of my late grandmother who talks about how hard the social isolation is. And we know that our seniors are paying the heaviest price, both in terms of social isolation and in terms of the death rate. But it's affected everybody of all ages. People of all ages have died. People of all ages have suffered job loss and pain and suffering. But look, we were one of the first states to help get this under control. We've been faring better than many of our neighboring states, but now we are seeing a shift in Colorado. Our October looked nothing like our August. We were doing it on August. October is far worse and more deadly, and we cannot afford a November that is like October. Here's the bottom line. We have now surpassed the hospitalization level we had in March and April, and we need to do better, getting back to what we know works. You know it. I know it. We just need to do it. It means wearing our masks whenever we're around others, avoiding gatherings of people outside of our households, just socializing with your own house and avoiding gatherings for people of all ages, physical distancing, washing our hands. If you're at all sick, stay home, get tested. We have two major powerful weapons that we didn't have in March and April. One is more testing, free, quick, and easy testing sites, over 80 across our state, covid19.colorado.gov. We're also working on getting out the instant testing to help prevent asymptomatic folks from spreading the virus. And the new contact tracing app, which I'm proud to say well over 10% of our fellow Coloradans have downloaded. And please download that on your Android or your iPhone. But look, each of us needs to do better. We need to see less people, as difficult as that might be for the next month. We need to physically distance. We need to wear masks whenever we are around others. And of course, wash our hands when we return home from something we absolutely have to go out to do, like go to the grocery store or go to work. Each of us has a responsibility to do our part. It may be the life of a stranger you save, maybe a aunt or uncle or cousin, spouse, friend, might even be your own life that you save. Now I'd like to turn it over to Dr. Rachel Herlihy to go over the latest updates on where we are in Colorado. Dr. Herlihy.
Thank you so much, Governor. Good afternoon. As the governor shared, sorry, is my video not working? There we go. Just a second. Thank you, Governor. Good afternoon. As the governor shared, cases and hospitalizations are increasing rapidly in Colorado. Can we bring up the slides, please? Great. Next slide. This figure shows you our 7-day average case count over time. You can see that we have had 3 waves of illness, a spring wave, a July wave, and now a fall wave. At this point, we are at our highest case count since the beginning of the pandemic. In the last week, we have routinely seen more than 2,000 cases per day in the state. Yesterday, about 3,000 cases were reported. You'll see the case counts look lower in the spring, and that is because we had much less testing available and we weren't identifying as many cases. Colorado has been working hard to increase testing availability to capture more cases so that people who test positive and their contacts can take action to prevent further spread of the virus. Next slide. We are also seeing a steep rise in COVID-19 hospitalizations with mounting pressure on our healthcare system. This figure shows you daily hospitalization counts in the state. Again, you can see the 3 waves of illness reflected in this hospitalization data. If you look at the far right and today's data point, however, you can see that as of today, we have exceeded our spring peak of hospitalizations, as the governor mentioned. I want to emphasize that we believe that there is more COVID-19 circulating in Colorado right now than there has been since the beginning of the pandemic. Next slide. This next figure shows you 7-day cumulative incidence of cases by county. We calculate this by adding up all of the cases that have occurred in each county in the last 7 days and then dividing by the county population. In this way, we can compare the amount of disease in one county to another county on a per population basis. Counties are color-coded by their level of disease, with the counties with the highest rates shown in red. The message here is that disease rates vary by county, though most counties in the state have seen a significant increase in the last few weeks. This is best illustrated really by the animation that is shown in the next slide. So this video shows you a time lapse of the 7-day incidence value over the past several weeks. On the left side, you see county by county incidence levels, and on the right, you can see statewide incidence levels. It moves quickly, so we can play it again. But in short, you can see that cases are increasing quickly, especially in the last few days in the state. And unfortunately, we see no signs of slowing or a plateau in the data, and it's likely that this increasing trend is going to continue at least into the near future. Next slide. The figures shown on this slide show you age group trends. On the left, you can see cases by age group, and on the right, you can see hospitalizations by age group. These figures show you how age group trends have shifted since the early fall. In the early fall, cases were concentrated among younger age groups that commonly have less severe outcomes, the orange and blue lines that are shown here. However, we've seen cases among older age groups increase significantly in the recent weeks, as shown by the gray and gold lines on the left here. This increase in cases in those over the age of 40 has also translated into more hospitalizations in those age groups, as shown in the figure on the right. We expect to see high hospitalizations among the 65+ age group, shown in gold, but we're also seeing many hospitalizations occurring among individuals in that 40 to 64-year age group, as shown in gray. We know that mortality data lags behind hospitalization data, but we unfortunately do anticipate that death counts will also increase in the next days to weeks. Next slide. This next figure shows projected hospitalization counts for the next few weeks. The black line shows the number of hospitalizations that have occurred recently. Each of the colorful lines shows model projections of hospitalizations based on the different days when the model was fit to our data. If you look at the model fit 2 weeks ago, shown in teal, you'll see that it is much less steep than the line associated with the model fit from this week. This week's projection is shown in red. Every week, our hospitalizations increase faster than the week before and are projected to reach higher levels. In short, we are moving in the wrong direction here. Next slide. This last figure shows you the projections for the number of ICU beds, or the highest level of care needed for Coloradans who become critically ill due to COVID. On our current trajectory, shown in gold, we are projected to exceed our ICU capacity shown by the dotted line in late December. When we reach that threshold, that means our hospitals need to surge or operate at crisis standards of care. The red and green lines show what will happen if we see less social distancing occur with the holidays, starting at Thanksgiving. We saw that same level of decreased social distancing associated with the 4th of July and Labor Day, and we're concerned that if gatherings occur the way they have with other holidays, that we could potentially see this decreased level of social distancing again. So if that happens, if we see that level of decreased social distancing, we see that the ICU bed need goes up even higher, and we reach that capacity threshold even sooner. Again, we are headed in the wrong direction, and our healthcare system will be at risk if we stay on our current path of disease transmission. With that, I'll hand it back to the governor. Thank you.
Thank you for that grim and sobering update, Dr. Herlihy. It has actually been spreading faster than the modeling predicted a couple weeks ago. That's what that line showed. And what we really need to ask ourselves as Coloradans, as Americans, as human beings is, do we have the resolve? Do we have the resolve to buckle down for the next few months and get this under control? I believe we do. I've altered my life to be safer. We walk our dog. I do a few socially distanced things that I need to do as governor, but I'm able to be incredibly productive. and be as safe as we can. I always wear a mask when we're out and around others. And I know that the more Coloradans do that, the better we'll be. I want to show this is really a matter of getting the facts to you so that you can make informed decisions that keep yourself and your family safe. And we're not doing that right now. But we're going to do a better job getting that information to you. I want to show you a video that's going out online and television showing the 3 simple things that we can do to save lives, slow the spread of the virus, and get our lives back sooner rather than later. Let's play the video.
Hi, I'm Dr. Rachel Herlihy, Colorado State epidemiologist working on the COVID-19 response. COVID-19 has been spreading rapidly in our state. Cases and hospitalizations are going up, almost as high as what we saw in March and April. The cases have grown so much that in the Denver area, about 1 in 145 people are currently contagious with COVID. Let me put that into perspective. In a week, if you come across 20 people a day, whether that's at work, on the bus, getting coffee, going to the store, or people in your neighborhood or friends, you will be in contact with someone who is contagious with COVID-19. Ask yourself, how many people do you interact with in a day, and how can you reduce that? I want to ask you to do 3 things starting today. For the rest of November, only interact with members of your household. Keep your distance, at least 6 feet at all times, and wear a mask. On behalf of the state of Colorado, thank you for stepping up and doing your part as we continue to do ours to protect you and your family.
Thank you, Dr. Herlihy. This is a wake-up call. This is a look that was recorded just a few days ago. It's on TV. It's already outdated. Dr. Herlihy said soon we might pass the April peaks of hospitalization. Well, we have. She said 1 in 145 are contagious with coronavirus. Now it's 1 in 100. It shows you how quickly the situation is deteriorating. We've really narrowed it down to the 3 things to try to make it clear what you need to do, what we all need to do to get through this in Colorado quicker and get back to normalcy and save lives. Just 3 things, very simple. They're actionable. We all need to do them. We need the resolve to do them and buckle down for the next few weeks and months. I am highly optimistic there will be a vaccine, hopefully available to many later this year and then widespread early next year. Here's what we're asking Coloradans to do during the month of November. 1, interact only with members of your own household. That means do your best to avoid social interactions with friends, avoid house parties, avoid going out with others or people who don't live in your home throughout the month of November. 2, keep your distance. Just because you are wearing a mask, that increases your safety by at least 50%, but it doesn't mean you're 100% protected. Try to stay 6 feet from others. Remember, you're going to encounter somebody every week, if not more than one person, that is contagious with coronavirus, and often they don't know. So treat everybody you encounter like they are that person, because some of them will be, and you don't know which ones they are. And finally, wear a mask. It offers additional protection. The numbers are clear. If you wear a mask, you have a lower risk of getting or transmitting the virus if you yourself are an asymptomatic carrier without knowing. If you're experiencing symptoms, get tested. There's more and more testing available for people that are asymptomatic as well that we're rapidly rolling out just to make sure that people can be screened to prevent unnecessary spread of the virus and loss of life. Over the last few months, we've all longed to get back to normal. We've become complacent. This has been combined with colder weather where we had some snow, people went indoors, some travel. It means that we need to renew our commitment and resolve now to get through one of the darkest periods in the history of our state and prevent unnecessary loss of life. I know this sounds daunting, but we can, if we make these changes during the month of November, we can be on a better trajectory for the holidays leading into a vaccine and cure, and it really will make a difference for our state. This is an important message we're trying to get out to as many people as possible. Don't just listen to it now. Those of you that are watching, tell your friends, text them, your family. We need to buckle down and only associate with our household for the next month. It's what we've got to do. We've got to have the resolve and the grit to get through this. This has been a tough year, 2020. And I know that everyone, myself included, are extremely tired of this virus. But the virus isn't tired of us. And we all have a really important role to play in protecting our communities. We all need to ask ourselves what we need to do to reduce the spread of the virus. Every time you decide not to go to a dinner party, not to go to a friend's house, not to invite someone over to your house, not to hang out with friends, you're making a difference in saving lives. Every time you wear a mask, every time you wash your hands when you get back from wherever you were when you were out. Look, put off those things a few weeks. We'll get back to it. We did it. And I'm not talking about March and April. I'm talking about we did it in July and August and September. We did it. We need to live now in November like we lived in August. If we live like we did in October, the toll will be immense for the people of Colorado, for our economy, and for our way of life. There'll be a day when things will return to normal. I think the vision and the light at the end of the tunnel are there. We hope that's early next year, but we're not there yet. We have work to do before we can bathe in that light and embrace one another once again. But believe me when I say we will get there together. Thank you, and I'm happy to take questions.
Hey, Governor, Jesse Paul here at the Colorado Sun. We are now, as you mentioned, in this really bad situation, worse off apparently than we were in April. Why are you not taking action to shut down more parts of the state? We're hearing from people that they're confused about the mosaic of restrictions from county to county, and it seems like things aren't moving fast enough to catch up with the spreading disease.
Look, nobody should be staying home and not socializing because you're in this county or that county. You should be doing it everywhere in our state right now. Cancel your plans to see others who are not in your household for the next few weeks. Put them off. You don't want to jeopardize your friends or loved ones or the great state of Colorado that we love. You know, I want to quote Dr. Burks, who was in town the other day. When she arrived, and she's been just doing incredible yeoman's work across the country, advising governors and health officials. And I said when she got here, I said, Dr. Burks, I wish you didn't have to come to Colorado. We hope that we didn't reach this point. She's been traveling to the hot spots. But the quote that I found very informative of hers is, "We're entering the most concerning and most deadly phase of this pandemic," said Dr. Burks. This is not about lockdowns. It hasn't been about lockdowns since March or April. It's about an aggressive, balanced approach that's not being implemented. And Jesse, we are going to do our part as a state. What does that mean? We're rapidly expanding instant testing for asymptomatic. We've set up drive-through and other testing facilities, over 80 across the state. We've expanded hospital capacity. And I need to ask our fellow Coloradans to do your part too. Cancel your social plans. Wear a mask when you're out. Keep a distance between you and others. 1 in 100 people are contagious with coronavirus right now in our state. If you encounter 10 people a day, cut it down to 5. If you encounter 5, cut it down to 3, 2. But you're going to encounter people who are contagious. So treat every interaction you have like that might be somebody who's contagious with COVID, because many of them are, and reduce your social interactions. Next.
Hi, Governor Mary Ann Goodland from Colorado Politics. Do you see any signs that people are actually listening to this? Because you have said the same thing for weeks on end. Wear a mask, socially distance. People don't appear to be listening. What can you do to get their attention?
So it is my belief that people were focused on many other things going on in our lives. We had a major election. A lot of people were focused on that on both sides. We had historic wildfires, and when you need to evacuate and your whole community's under threat and you might lose everything you have, the virus, takes a second or third rank behind that. We're mostly past those. By the way, we're not past the fires, but there's less people threatened today than there were a few weeks ago. We're mostly past the election. The voters' part is done. The votes need to be counted. The winner will be declared. Now's the time to return the focus to being responsible and having the resolve we need to reduce the spread of the virus and save lives in Colorado. That life you save may be your own or your friend. So put off your social plans, delay social gatherings, wait a few weeks. wear a mask whenever you go out or in public, keep your distance, and wash your hands when you return home.
Governor, good afternoon. Stephen Tubbs with KNUS. I have one question and one quick follow-up, if I could. This is about as serious, I think, as a lot of us have heard you speak about this, and from Dr. Herlihy as well, and the television spot already outdated. Denver and Jefferson County gave a little bit of notice. Are you feeling that it's just a matter of time before this state is shut down? The numbers certainly would point that way, and I'm wondering what the officials are telling you about that right now.
I haven't heard anybody talk about a shutdown or a lockdown. I think that many of the counties in the Denver metro area are absolutely looking at additional mitigation steps, whatever they are. We've seen different cities and counties take different measures that are necessary to reduce the spread of the virus. But, Stefan, it wasn't that long ago, a month or two ago, where you remember we were overperforming the estimates. We showed some of these estimates and models, and then 2-3 weeks later, our numbers were better than what we showed, and people said, oh, the worst didn't come to pass. I want to make it clear to Coloradans that for the last few weeks, we have been severely underperforming the models. Every model we've had, there have been more people hospitalized quicker and more people catching the virus than any of the modeling that's been presented over the last few weeks. And that will not change unless people's behavior changes, right? And there's no action. This is why you don't, there's no action your county or state can take for you not to go socialize. It has to be a decision you make, not to socialize. A decision you make that your life is worth it, that your friend's life is worth it, that your family's life is worth it. And now with the election mostly behind us and the fires mostly behind us, I want Coloradans to really focus on what's important in our lives. At the end of the day, it's about your friends, it's about your family, it's about your life.
Governor, just a quick follow-up. Would there be any type of scenario that you have seen or would talk about where the state would be given, all right, in 48 hours, this is going to happen? Reason I ask is because I think Jefferson County announced earlier today that by Monday, it will be going to 25% capacity, much like the city of Denver did. And I think Denver gave about 24 hours, maybe a little less. But I think there are a lot of business owners, obviously, that would like to know that type of thing, and people going to work and whether or not they will go to work.
Well, I think that when the virus is as widespread as it is, it's a reasonable step that some communities are taking to reduce indoor occupancy, which we know is one of the vectors that this spreads in. So if that's what your local health officials are doing, we're supportive of that. But it comes down to our individual decisions to avoid going out and socializing, because you know what? There's nothing Jefferson County or Denver can do about what goes on in people's homes. And so we need to act responsibly, only socialize with our own household for the next few weeks. Let's do it. Let's defeat this thing. Let's win. We're better than that.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión Colorado. Gobernador, en español, ante el aumento de casos de coronavirus, hemos visto que gobiernos locales han realizado algunas restricciones para contener el virus, pero aún así hay personas que viven en un condado y trabajan en otro. ¿Cree usted que esto podría propagar la infección del virus y si tienen considerado volver a cerrar nuevamente el estado?
Las personas tienen que ser seguras en todas partes del estado. No se importa la ciudad. Es importante que todas las personas en el estado y el país trate de solo interactuar con las personas que viven bajo su mismo techo por el mes de noviembre, al menos que sea para trabajar. Usen un tapabocas y mantengan distancia por lo menos de 6 pies todo el tiempo en todas las partes del estado y del país.
Hello, Governor. This is Vinny Deltrude at Bloomberg News in Denver. Does Colorado now face a catastrophe on the scale of what New York and New Jersey saw in March and April? Thank you.
If Coloradans don't heed this message, that's very much the direction that we are heading. We are now at the same level of hospitalization that we were in March and April, and that will be going up the next few weeks. days. That's baked in. I mean, if we change our behavior now, cancel our social plans, it still goes up for a few days as the incubation period. It won't go down for a week or two. That level is not as high as the hospitalization rate was in New York and New Jersey, but it'll get there. The virus is the virus. It thrives when we are complacent and when we forget that it is amongst us and we have to learn to live a new way. And that is something that we remembered in August, we remembered in September, but we forgot in October. So we need to go back to how we lived in August right now. We were able to get by, we're able to be productive, to enjoy ourselves, but we've got to cancel those social plans these next few weeks. And hopefully we can avoid becoming a national hotspot with overflowing hospitals like we've seen in New York and New Jersey.
Governor, good afternoon. It's David Clue at Denver 7. Hopefully Colorado is hearing your message today. The rest of the country, perhaps the rest of the world, may not. So would you consider any restrictions on out-of-state visitors, including travel restrictions or quarantines for those visitors, understanding that we don't know what's going to happen between now and, say, Thanksgiving?
The virus is rampant here. 1 in 100 Coloradans right now are contagious with COVID-19. Many of them asymptomatic, don't know it. Maybe half of them, they might develop symptoms later, or they might just spread it or have minor symptoms and not know it. So look, whether somebody is from Aurora or Denver or Grand Junction or Atlanta or Chicago, when we interact with people, everybody we interact with, we should treat as if they're contagious with coronavirus. It's not about where they're from. It's about the precautions that we need, the mask wearing, the distancing, and avoiding social interactions with people who are visiting from Chicago, just as we would do with people who are living in Aurora.
Hi, Governor. Taylor Summers from NBC News Radio. With cases of COVID spiking weeks before Thanksgiving and potentially Christmas as well, would you consider possibly instituting a stay-at-home order or some sort of modified order leading up to those holidays in order to bring the rates down to blunt a potential surge?
I think many families like ours should plan to have Thanksgiving with those who live in their household, and maybe incorporate grandparents, aunts, uncles, friends in over virtual or Zoom, or simply plan to have a Thanksgiving in February or March when people are safely inoculated against the virus. But I think that the normal way that we have Thanksgiving, multi-generational folks gathering indoors, is very dangerous, which hopefully would give an extra reason to turn the picture around the next few weeks. There is time before Thanksgiving. If everybody who watches this and everybody who isn't watching this cancels their social plans, doubles down on mask wearing and keeping distancing, and just interacts with less people, far less people than they normally do during a day, we hope that we can be in a better situation by Thanksgiving. But I would advise people to make those plans for a non-traditional Thanksgiving with your household only.
Hi, Governor. It's Jessica Seaman with the Denver Post. With hospitalizations where they're at what point do you expect we could see the alternative care sites activated?
So two things on that. One is we're not there yet. But the second thing is those are non-ICU beds, and the immediate danger is on the ICU bed side. We will be presenting additional updates about expanding ICU beds. Where hospitals expand ICU beds, they generally take the place of some of their non-ICU units. That would mean, if that's the case, we would need to open the convention center to house some of those non-urgent cases, to free up what are normally non-ICU beds to be converted into ICU beds by the hospital. That's the plan we've worked on with them over several months. It's ready to go. Beds can be activated in a week. That's not a call we're making today, but this is a wake-up call that Colorado is getting there, and we need to make it an intervention. This is an intervention. This is a change, right? Maybe you've had people in your life sit you down and say intervention. I mean, if you've been through alcohol or 12-step, or it could be some other behavioral thing at some point in your life, your loved one said, let's sit down, this is an intervention. Colorado, I love you, this is an intervention. Cancel your social plans the next few weeks. Avoid interacting with others. Wear a mask, keep your distance. let's get through this.
Governor Michael Booth writing for the Colorado Sun. We knew that the third wave was coming. Some testing sites are running out of capacity at 8 o'clock in the morning. Why was not more done to increase testing capacity up to this point for this high season that we're running into?
We have plenty of testing. So if there's a testing site running out, just connect them with us. We will get them the tests. We have over 80 testing sites across the state that we partner with and help supply. Those are at covid19.colorado.gov. You can go to Waterworld in Aurora. There's one. There's several in Denver. And we if anybody needs any testing supplies, just let the state know. But we regularly get those up to date and try to make that as convenient as possible for people.
Governor, this is Sonia with 9 News. My question is along the lines of Thanksgiving and holiday plans, but focused more around traveling. Locally, and even if we go outside of the state, what would be your guidance and advice for that? And it sounds like from the previous question that you're saying that if we all buckle down and do our parts, maybe this can look a little bit differently for Thanksgiving.
So I based on all the science and the data we've seen, the most dangerous part is not the travel part, right? In fact, even if you're flying, the most dangerous part is not the plane. It's the airport and the security and the interactions with other people. But even that is less important than what you do when you get there, right? Are you socializing with many other households? Is it an area with high disease prevalence? If you have family coming here, can you stay at home for 10 days before they come to make sure that you don't infect them, since the rate is so high in our community? So those are the kinds of things that people need to be aware of. Everything is a risk, and traveling is no different, the actual act of traveling, but that's not the main part of the risk. It's what you do when they get here or when you get there that people need to be careful about.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking my question. I guess this is for you or Dr. Herlihy or both of you. What do you think, based on the data, is driving this rapid increase in transmissions and infections?
I'll go to Dr. Herlihy.
Thank you for the question, John. So as the governor has spoken about quite a bit, we know that there is COVID fatigue occurring. We know that individuals are tired of this virus, but as the governor often says, this virus is not tired of us. And so we need Coloradans to remember all of the strategies that they've been using to prevent disease transmission this summer. There's other factors as well. We know that around holidays, we see spikes in transmission. We saw that for the 4th of July. We saw it for Labor Day. It's quite possible we're going to see that for Halloween. I think it's why we're talking so much about Thanksgiving and the winter holidays. We also know that Coloradans are moving indoors more, and we know that this virus is much more efficient at being transmitted from person to person in indoor environments. The science around respiratory viruses also tells us that they prefer cool, dry climates. And so some of this could also be related to change in seasons. We're still learning so much about this virus and trying to understand how much of a factor seasonality might play here.
Hey, Governor, this is Gabrielle from Fox 31. Just had a quick question. You mentioned it earlier that a lot of people have a lot of strong opinions about the election. Is there a concern about people gathering for possible protests in the wake of the election?
Well, I'm always concerned from a health perspective about any gathering of people, and I've expressed those concerns about people who are gathering for different causes in the months before. And if people do want to have their voice heard, if you're going to be outside, wear a mask, do it apart from others, but consider doing that virtually, and consider doing that in a different way than in person, so you don't put people who have the same beliefs as you at risk. I mean, 1 in 100 people are contagious. There's more than 100 people at these things. You know that if some of them are contagious. So just be very careful with that. And I would share the public health concern about any gathering. I believe that is the last question, or is there another, or is that the complete questions? I think we've got through it. So wake up call. Let's show the resolve that we're better than this virus, that we know we've been distracted. The fires and elections, mostly over, both of those things. Let's show the grit that we need to bear down, cancel our social plans, avoid interacting with others, reduce the number of people we see, and let's get through this. Thank you, Colorado, and God bless.